Hello and welcome. Today we're diving into a relatively rare but important condition affecting the urinary system, bladder hypoplasia. We'll explore what it is, what causes it, how it impacts the body, and what can be done to manage it. Let's get started. Bladder hypoplasia in essence means underdeveloped bladder. This usually happens during fetal development. Several factors can contribute. Genetic mutations or hereditary conditions are sometimes implicated. Exposure to certain toxins or drugs during pregnancy might also play a role. In some instances, there's no identifiable cause and it's classified as idiopathic. The pathophysiology of bladder hypoplasia revolves around its reduced size and functional capacity. Because the bladder is smaller than normal, it can't hold the usual amount of urine. This leads to frequent urination and a reduced ability to fully empty the bladder. The detrusor or muscle, responsible for bladder contraction, might also be affected, further compromising bladder function. The constant high pressure and incomplete emptying can damage the kidneys over time, which can cause issues such as vesicoureteral reflux, in which urine backs up into the kidneys. Epidemiologically, bladder hypoplasia is considered rare. Precise incidence figures are difficult to obtain due to its often subtle presentation and the challenges in diagnosis, particularly in milder cases. It is usually diagnosed in childhood and may be associated with other congenital abnormalities. Studies that collect the correct data are necessary to discover the real frequency of bladder hypoplasia. The signs and symptoms of bladder hypoplasia vary based on the severity. Common symptoms include frequent urination, both during the day and night, known as nocturia. Children might experience daytime urinary incontinence or bedwetting after the age when they should be dry. They may also have a sensation of incomplete bladder emptying. In more severe cases, complications like urinary tract infections become more frequent and severe, and kidney problems can develop. Diagnosing bladder hypoplasia typically involves a combination of methods. A detailed medical history and physical examination are crucial first steps. Imaging techniques such as ultrasound, voiding cystoscopograms, VCG, MRI can visualize the bladder size and structure. Aerodynamic studies, which measure bladder pressure and function during filling and emptying, are essential to assess how the bladder is working. Ruling out other causes of frequent urination, such as diabetes insipidus or urinary tract infections, is also important. While bladder hypoplasia isn't generally categorized into distinct types, its severity can vary significantly. Some individuals might have a mildly smaller bladder with minimal symptoms, while others experience severe limitations in bladder capacity and significant complications. The classification is therefore usually based on the degree of bladder underdevelopment and the impact on the patient's quality of life. Treatment for bladder hypoplasia is tailored to the individual's symptoms and the severity of the condition. Behavioral therapies, such as timed voiding and bladder training, can help improve bladder control and increase the interval between bathroom trips. Medications, such as anticholinergics, might be prescribed to reduce bladder spasms and urgency. In severe cases, surgical options, such as bladder augmentation, where a piece of intestine is used to enlarge the bladder, may be considered. Intermittent catheterization might be needed to ensure complete bladder emptying, especially if there is significant residual urine. Preventing bladder hypoplasia, unfortunately, is challenging because many causes are related to genetics or events during early fetal development. However, pregnant women can reduce the risk by avoiding known teratogens, like certain drugs and toxins. Genetic counseling may be recommended for families with a history of congenital urinary tract abnormalities. The prognosis for individuals with bladder hypoplasia varies considerably, depending on the severity of the condition and the effectiveness of treatment. With appropriate management, many patients can lead relatively normal lives. However, some may experience chronic symptoms and require ongoing medical care. Recent research focuses on improving diagnostic methods and developing less invasive surgical techniques. Gene therapy and regenerative medicine are also being explored as potential future treatments. Continued research offers hope for improved outcomes and a better quality of life for those affected by bladder hypoplasia.